After a little while, the poking becomes an awful lot, and what happens when it starts hurting, you have scar tissue that builds up on your veins, and that causes pain, just like any other tissue that builds up on any surgery site. I'm making this video because today I randomly got on my Girl Without Guts Gmail, and I came across somebody from myiv.com who has reached out to me after being on my Crohn's the Invisible Disease website on Facebook. And she's reaching out to me because she thinks that I have more to offer regarding my experiences with IVs and ports. So they want to spotlight me. I have been on the website and to look at it and see exactly what kind of experiences they're looking for and what I can bring into their site. As you guys know, as my disease progressed, I had the need for magnesium, potassium, a lot of antibiotics, just a lot of different things. And a lot of people, while they're in the hospital, have experiences infiltration. And that's basically when your vein has blown. When you have an IV, the IV fluids or antibiotics go up underneath the skin, and once the IV is removed, all that will come out from underneath it. And like me, I bruise extremely easy. I blow veins extremely easy. So even getting blood work is like almost impossible. Usually they have to use a butterfly if they have to get blood work, and I'm somewhere where they can't use my port. So another thing that we go through when we have chronic illnesses and diseases is we have been stuck so many times that at first it doesn't bother us because we're just now getting poked a lot. After a little while, the poking becomes an awful lot, and what happens when it starts hurting, you have scar tissue that builds up on your veins, and that causes pain, just like any other tissue that builds up on any surgery site. Scar tissue builds up, causes problems, causes pain. It does the same thing on our veins. Sticks started becoming harder, started becoming a lot more painful. Before I could handle sticks and it not bother me. I could sleep through getting blood draws, not faze me. Now, if they try to get IVs because for some reason my port cannot be accessed, it hurts like a bitch, and I'm not going to sugarcoat it. Usually it takes about 6 or 7 tries before they even get the one, and once they get that one, we're lucky if it doesn't blow very quickly, and if it lasts 6 to 12 hours. In one hospital stay that I was in last time, I was in there because I wasn't sure if I had an infection, and neither was the ER doctor or the hospitalist that I had. So they wanted to keep me in there and keep running IV fluids on me. So my port could not be used until I got clearance that it was not an infection. Since it was not an infection, they had to make sure that my port was still in placement and that it could be accessed before I left the hospital, because I run IV fluids infusion on a daily basis because I get dehydrated extremely easy due to my Crohn's disease. I have an ileostomy, which is your small intestines coming out through your abdominal wall and your small intestines, and you have your feces coming out through a bag. I know that does not sound very lovely, but for some of us, that has improved our daily lives, and it makes our lives a little bit easier than keep running to the bathroom or making long trips unbearable. So I get dehydrated very easily. I can drink all day long. My body does not absorb it. My body actually needs the fluids to go in through my cells to hydrate my organs, because drinking it just does not absorb it. 2, I have gastroparesis, which is it is paralysis of your stomach. Your stomach either just doesn't work at all, or it just very, very slowly works. My stomach, after 4 hours, when most people's stomach is completely empty or might have 10% at the end of 4 hours, mine has only emptied up to 83%. So I also have a gastric pacemaker, or same way as a pacemaker for your heart, except it's for your stomach. So with this, has also caused a lot of extra issues, making me become admitted into the hospital with a lot of extra sticks when my port couldn't be used. So after so long that you're been poked and poked and poked, eventually, it just becomes impossible to get an IV or to get the IV to stay. My very first, no, it wasn't my first hospitalization. It was my second one, and I had a really big operation, and I was in the hospital for a month. They couldn't figure out what was going on, why this wasn't working, or why that wasn't working, and I kept losing weight because I kept on having bowel obstructions. I believe I had 3 bowel obstructions and a DVT. I got a TPN and a PICC line. A PICC line, they usually just run up through one of your arms and into your artery and up through your carotid and also down above your heart. I had one then, and then I was in the hospital again in 2014. That was also another major surgery, and no, that was 2013. I had another PICC line, and it was threaded, and so then in 2014, IVs just kept blowing and blowing and blowing, and so my surgeon says, let's try another PICC line. The IV team came in. It was the same woman that had placed both of my PICC lines. She said the second PICC line she barely got to thread. She said, I am not even going to try a PICC line on you. She said, it's not going to thread. The second one just barely got through. She said, I'm not going to do it. You need something permanent. You need a port. So then a surgery intern came in. I still have the scar. He attempted to put in a, oh shoot, now I can't think of the name of it. Central line. He kept messing with it, You really can't feel it until they hit something they're not supposed to hit. I told him to stop and get out. I could feel my blood gushing out of my neck. He finally pulled out, didn't clean me up, but once he pulled out, the blood has subsided, but it's still leaking. And so he said, well, no, we're not going in my groin, thank you. You better think of something more permanent, because I'm not going to just have this problem now. I'm going to have this problem continually. So after talking with my surgeon, he said, I need to go down with a port. I went down, I got my port. I had my port 4 years. Never had a problem. Every once in a while, maybe I get good blood return, maybe not. I had to see a hematologist, and I wasn't getting blood return. The nurses down at the hematologist were not nice. They put the cath flow in and did not let it sit and see if it was going to work. Oh, well, it's not going to work. You need to go see your vascular surgeon. I did not have a vascular surgeon. I had my port placed in the hospital. So when I got home, I reaccessed my port. I had blood flow. The cath flow worked. So in this year, I went in because I thought I had an infection, which I didn't, but the doctors wouldn't let me go until all my bacteria tests came back and showed negative. Then they made sure that my port was working before I went home. Now, mind you, I do all of my port care. I had home health, and I didn't have my port for very long before I started de-accessing and accessing, because we had a really bad storm and my nurse couldn't make it to me. So I de-accessed, took a shower, and re-accessed it myself. Now, it took me a couple of sticks. I went through a few needles, but I got it. And I've been doing it ever since. So I did not have an infection. They said I had an irritation. I had a skin infection is what I ended up having. How I got that, I don't know. But we have MRSA on our skin, and we don't know it. The biggest majority of us have MRSA in our nose, and we don't know it. We could all get swabbed today, and it come back positive. So anyway, I got discharged in February. So then the 1st of June, my port was just kind of sore, and I didn't really think about it. I was just back and forth. And then I went to change it and noticed that my port was eroding through my skin. The skin on my port had broken open. So I went to the hospital, and upon giving my information for basically admission into the ER, they asked me why I had my port. I said, because 1, I have no vascular access. 2, I do IV hydration fluids therapy every day. And 3, every so often I do IV infusions in the hospital, and I also do IV Phenergan pushes and IV Zofran pushes as well. I get back to the ER triage. The doctor doesn't listen to me. She talks to the vascular surgeon. So instead of having the vascular surgeon come in and consult me, she decides she's going to tell the vascular surgeon whatever she wants to tell him. So what she tells him is, I have no vascular access. I'm having problems with my port, accessing my port. And I don't even know. It's just a mess. So the vascular surgeon said, we'll do a x-ray to see the position of the port. So x-ray comes. Because now, they can do your x-ray right there, and then you can see what the x-ray looks like. So I said, well, let me see what the x-ray looks like. I'm like, oh, well, that's perfect placement. I could have told them I had no problems drawing blood. I have good, I have good blood return. That's not the problem. My port is open. So she comes back and she says, well, vascular surgeon says you're fine, just to go see your primary care physician tomorrow, and we will give you a vascular surgeon to follow up with. And I argued with her. I said, the reason why I'm here is because my port has opened up. It's eroding through my skin. My skin is broken over my port. It's infected. Well, I talked to the vascular surgeon, and this is what he says to do, and this is what we did, and your port's in perfect placement. I said, what do you know about ports? Obviously nothing, because I'm in here because I have an infection. This thing goes up over into my heart. I have a low-grade fever, so there is obviously something wrong. Well, I talked to, you know what? You don't know what you're talking about. Well, you need to do sterile precautions with your port. Okay, I've been taking care of my port for 4 years. I do sterile precautions. That's not why I'm in here. So I'm like, I'm done arguing with this woman at this point. I'm about ready just to slap her, because as far as ports, she's pretty dumb. The whole time I was in the ER, I watched her go from patient to patient to patient and not listen to them and literally discharge them. So sometimes it's the doctors that have the problem and it's not the patient. So I get my paperwork. I don't make a phone call to my primary care. They call me and I'm like, look, this is not my primary's problem. This is vascular surgery. So I see the doctor's name. I see the phone number. That's the same group that my colorectal surgeon is in. So I call it. I ask about this doctor. Oh, well, we don't know him. He doesn't practice here. So I'm like, okay, well, this doctor is the doctor that put in my port. Can I get in with him? He's out of the office for 3 weeks. Okay, no problem. But we can give you to the person that's taking his patients. Okay, well, let me send you directly there since you're having this issue. Great. I get in at like 9:30 on Tuesday morning. He does my port's accessed, okay? He says, you don't have to take that off. I can see it right now. It's infected. It has to come out tomorrow. I said, but I have to have one. Well, you can't go back in there. Well, we can put one on the other side. I'm fine with that. That's great. I just have to have a port. So on the 6th, on Wednesday, now I went to the ER on Sunday. I had to make my appointment on Monday. I seen the vascular surgeon on Tuesday, and I was in surgery on Wednesday. So I was in a lot of pain. But I asked for pain medicine, which is something I don't normally do, but I was in some pain. I only got 12 pain pills, and I took them over a course of 3 weeks. Now, mind you, this is muscle up in here, and this is where the old port was. It is still slowly closing. This was closed, and now it's not deep, it's superficial. But this has gotten so much smaller. I had a problem with it, and I had to well, hey, good. It's done. Scar came. Anyway, so this is the new one. And I don't normally tape it right here. I had to buy some special tape because my skin is very, very sensitive. But this is the new port. It's literally a new port. It is called the Bard Power Port Clear View Slim. This is a whole new thing. It is very hard to access. I can only feel one nub, but I can feel the whole port. Sometimes I can get it on the first try. Sometimes it takes me a couple of tries. It's just really a different one, and my surgeon had to take out fat to get it up there. My scar is not healing all the way. I mean, it's healed completely, but I have a rough area because when he took the fat out and he pulled my skin together, I had extra skin. So, anyway, right now, I have argued with basically the nurse manager over the ER. Then she sent me to somebody that's over her. And basically, when I talked to her, it took me 2 weeks to get to her, to finally get anything. And so what happened there was she was trying to cover for the doctor and everything. Told me, well, she said she did a head to toe exam. I said she didn't touch me. Said that it was that I was complaining of vascular access. I said, no, that's not correct. They asked me why I had it. I said I had no vascular access. Said that my skin was just irritated. I said, no, it wasn't irritated. I had my skin was open over my port. I have pictures of it from that day. What else? Oh, she just was trying to cover up from the doctor. So I said, well, what do you want me to do? I said, I want you to talk to your doctor. This isn't the first time I've had her. I said, you need to talk to her and tell her she needs to listen to her patients, because she obviously doesn't know anything about ports. I should have been seen by a vascular surgeon. And she kept telling me, and the woman I was talking to kept telling me, well, there's nobody there on that time. There is a vascular surgeon, whether it's an intern or a fellow. There is a vascular surgeon in that hospital. And anyway, IR also does ports. So they could have sent me down to IR and let IR look at it. So either way, she doesn't know what she's talking about either, or she's just trying to pull the wool over, the wolf's eyes. But she's not going to pull the wool over my eyes. So finally I was like, well, you know what? This doctor can be turned in for malpractice. Why? Because she failed to diagnose me. So she asked me, well, what else do you want? I said, I want the charges reversed for my copay. I have $100 copay. You did nothing for me. Well, I see you went to this other hospital. I think it was like on the 11th. I said, yeah, I did. I said, my port infiltrated. And I couldn't re-access it because it was too swollen. So I wanted to see if they could. Well, they couldn't. After a couple of sticks, they were able to get an IV started and give me some IV fluids and some Phenergan. I had resorted down to taking IV Phenergan, putting it in a glass, and drinking it. And that stuff is really gross. Next step will be, I guess, contacting the hospital administrator and possibly the news station. Maybe shining the light on this, because when you have a port, this goes up through your carotid artery and into the top of your heart. This isn't something that you play with, but some people seem to think that it is, but it's not. And it's really irritating, because how many more people are like that? I could have went home, it could have got worse, and I could not have woke up the next day. There's a lot of couldas, but there's a lot of truth to it. So, this doctor needs to be reprimanded. I don't want her to lose her license over it, but she needs to be some strong arm there, and maybe a little disciplined. Because if you're going to work in the ER, you need to learn a little bit about something, or at least have somebody come down. I've had other ER doctors have specialists come in to look at me, because an ER doctor is just that. They are an emergency department doctor. They are not specialists. So if they're not sure about something, they bring them to me. So, we have to advocate for ourselves. If you're not sure about things, there's always tons of videos on Google. I've always got stuff here on my channel. And, if you're not accessed correctly, whether it is your IV or a port, and you have something like Phenergan, for instance. Phenergan can be a nasty, nasty drug. If you're not accessed correctly in your port, or you're not accessed correctly in your IV, in an IV, straight up IV through your arm or foot or wherever they put it, it burns, and it's really, really hard on your veins. So is potassium and magnesium. Really, really hard. I found out Cipro is too, because I'm used to having all that put through my port. But a lot of different things are hard on you. So if some of these things exfiltrate, they can cause a lot of tissue damage. Phenergan, for example, can cause gangrene. If it is not if you're not accessed correctly, it can cause gangrene. And you can lose your life, you can lose a leg, an arm, a part of your abdomen, a part of your chest, anywhere. So, IVs, ports, PICCs, any of that, it is very important to know anything about any of these, because this is your body, not theirs, and you're the one's gonna have to live in it, not them. They're still gonna get paid. You're the one's gonna have to live with the results. So, when I talk about advocating for yourself, stand up. Don't let them bully you. Don't let them tell you things that if you don't think it's right, then it's probably not right. I had a doctor one time who was having a bad day. I didn't like him, but he was a good doctor. And he told me one day, well, if you don't get up and go to PT, if you don't do PT when PT comes in here, then you're going to a nursing home. And I looked at him, I said, I'm not going to a nursing home, and you can't make me. And he was my surgeon's fellow. I told my surgeon made him apologize to me, because they will intimidate you. They will try. And some people succeed because you let them. You have patient rights. Whatever you want, they can't make you do it. If you don't want to get up and walk, you don't have to do it. But you have to live with with the outcome. If you've had surgery and you get a blood clot, then that's your problem. That's not theirs. But that can be an outcome. I was walking and I still got a blood clot. And when I got it, I had it for like 3 days, and it just kept getting worse. And I just thought it was a Charlie horse. So, if a doctor tells you have to have this medication, or he wants you to have this medication, but you think there's more wrong with you, and you insist on surgery, and they keep trying to push a drug on you, but you think you need to have surgery, you have to stand up and say no. We're going to do exploratory surgery. I did it. And I'm glad I did, because I had colon cancer and my Crohn's disease. Together, my colon was nothing but diseased. I lost my colon, my anus, and my rectum, and as a bonus, it took out my appendix. Sometimes before the doctors know that you're losing weight, you know that you can't eat, you're having bowel obstruction after bowel obstructions, and I got down to like 65 pounds, and I looked down at myself and I just cried, because I only weighed like 95 pounds when I went in the hospital already. Well, I don't weigh that now. I weigh a whole lot more. But, before they even tell you that you need a TPN. So that would require a PICC line. And so, you know, there are different IVs. And, you know, I personally don't like central lines. But I almost told them, I was coming really close when I was in the hospital in February. Because they just, I mean, my arms, every time I come back from the hospital, ER, or coming out of the hospital when I can't use my port, I look like a druggie. Because my arms are just, and I still got just very faint from, I think it was June the 11th that I went to the hospital. So, you know, I can't get a PICC line, but I could get a central line. And, you know, I don't like them for the simple fact that it's in your neck. And, well, having this right here and pulling it is not fun either. But I just, something about it being in my neck, I don't like it. Anyway, if you guys have any questions, just let me know. Because, like I say in all my videos, I don't mind telling you anything. I have been through a lot. And I've had a lot of IVs. And I've had some PICC lines. And I've had several central lines. And I've never had a double lumen port. And the double lumen wouldn't be bad. My last very, very big surgery, I had to have blood, a lot of blood, because I lost a lot of blood. And I came out with a central line with, you know, that's what they put the blood in with. And so sometimes I think a double lumen would be great. However, I'm having problems accessing this new port, so I'm not exactly sure how I would be accessing a double lumen. You hear more people talking on YouTube about accessing their own port than you do when you meet somebody out on the street. A lot of people don't access their ports. It's usually people that have it long term, that use it on a daily basis, that you'll find that access their own ports and de-access and do all of that. I've never ran into anybody here that do their care. That they find it very odd that, you know, somebody would be doing their own port care. And I'm spoiled to only one brand. Basically just because of the way it's made, and it makes it easier to access your port. So I have many videos on me accessing my port. I've not done one with this new port because I'm still learning about it. I prefer to have the central line and surgery while I'm knocked out. I'll tell you that. But I didn't really feel anything until he started getting close to my esophagus. I was like, are you supposed to be there? Am I supposed to be there? No. Okay, well then you're in the wrong spot. But other than that, you guys can check out the other videos that are on my channel. I have an IV. Why do I have IV fluid and accessing my ports, and I will put them up here in the cards for you. So you guys have a good night and see you tomorrow.